Okay. Let me make sure that we're alive. Okay. Let me make sure that we're, okay. Hello, everybody. Welcome to Dental Shadowing. Today we have Stephanie Tran, and she's going to talk to us a little bit about how she is a registered dental hygienist. So without further ado, Stephanie, you can take it away.
Thank you so much, Hannah. So as Hannah mentioned, I am Stephanie. I am a registered dental hygienist here in Ontario, Canada. First, I want to say thank you so much, Hannah, for giving me the opportunity. I am a new grad. I'm a very recent grad here, and I just started working full time. It's definitely been a learning curve, and I think that this is a great platform to discuss my career and the reason why I got into it and how I got into it. There's a lot more than just cleaning teeth, essentially. So this is great. I love this. If anyone ever has any questions, feel free to just email me at my email or hit me up on Instagram there. So a little bit about me is that I am Vietnamese and Chinese. I do speak Vietnamese, but not so much Chinese as much as I wish I did. I did graduate from St. Clair College, which is a local college here in my area. They are the only one in this region that offers the dental hygiene program. Some hobbies and some interest of me is watching The Office, which I love. And a guilty pleasure is definitely watching any TLC show. Anything that is like cringy, I love. And spending time with my friends and family, definitely. I'm a family person. I come from a really big family myself. So family is really important. And then Instagram. I actually just recently got onto the dental side of Instagram, and it's a really awesome community. Hannah, if you can kind of relate to it, everyone's just so honestly so encouraging. And if you are, or anyone who's interested in pre-dental, dentistry, dental hygiene, dental assisting, get on Instagram, make an account, follow anything dental related. There's some great case studies, some great knowledge that I learned from the dental Instagram that I would not have in school. So it's very interesting that way. Why dental hygiene? So I can kind of relate to everyone or anyone who's watching this live here in high school at 16, 17 years old in grade 11 or whatever it is. I'm sitting there trying to figure out what am I supposed to do with my life, right? And it was stressful, and I can relate to that because it was a hard time. It was a lot of stress. How do they expect a little high schooler like me to like plan out my life? But I was very lucky. I actually, one of my first jobs was at a private dental office. They were trying to find a way to get all their paper charts to go digital. So I was sitting there scanning and scanning and scanning. And I was sitting there and I was like, I really like this environment. It's fast paced. You see everyone working as a team. And I was especially curious on the dental hygienist. What are they doing? What are they doing? And the paper charting kind of led to me working as helping them out with like charting and typing things for them. And then that led to helping out with sterilization. And it was just a lot of interesting knowledge. I've never, I was always the patient. I never saw the behind the scenes. And it was so interesting. And when you have so many of these tasks and you are such in a fast paced environment, you kind of look and like the days going by. And I love that. I really do. So I also really admire the clinician and the patient to clinician rapport relationship. We had patients coming into that office that had been there for such a long time, and you really get to know their family. And I really like that. I always knew I wanted to find a job that to help people and also to find a job that is in the health field. I knew I couldn't really wrap my head around nursing, but I knew that I wanted to be something in in health. And dental hygiene was just it sounded so amazing. Because so I, growing up, wanted to be a teacher. I didn't know exactly what I wanted to teach, but I wanted to educate and everything like that. Um, and I'll talk a little bit more about the different aspects of dental hygiene and what different roles we incorporate in the job. And then lastly, the reason why I chose it is the satisfaction you see in your patients, the before and after. Patients come in and they are unaware of their current state of health. They have gum disease, bleeding, and maybe even bone loss, like periodontitis, and they're unaware. They just don't know. They don't know better. And when you are the person to educate and talk to them about it and tell them, this is what you have, these are your current findings, and let's find a way to get you back to health. You see the progression, you see the motivation that you have, and I think that is amazing. Um, so some skills of dental hygiene or of a dental hygienist, I think if you have these skills, dental hygiene would be a breeze to you. We'll make it a little bit easier at least. Being able to be time efficient and quick. You are, like I mentioned, fast-paced work environment. You have patients back to back, and if you are thinking about going clinically, so being fast and being able to getting used to your regime and knowing your routine, it really does help. This next step or next skill, I think, is crucial for all medical professionals or anyone who's in the health as a health provider, and that is compassion and empathy for people. Um, people have fear of going to dentists. It's not unfamiliar. We all know that there are people who suffer from real fears and phobias and traumas and triggers. They don't want to be at the dentist. And the last thing they need is someone to lecture saying, you're not brushing enough, you're not flossing enough. We've all heard of that. And we all know that. And I think that if you kind of show that you're coming from a spot that I am here to try to make things better for you and make it like easier for you, it is a little bit, it makes it a little easier for the patient or the client. Next thing is being able to work effectively alone or in a team setting, because at the end of the day, you are working in a dental office. I always think a great dental office is someone who has a great team. If I'm running behind on a patient with a patient, I want to know that my team's got my back and they're cleaning up or they're setting up wherever I need them to be. And then I also that one-on-one with the patient. You're working independently with you and your patient versus if I was in dentistry or if I was a dentist or dental assistant, I'm working with the dentist or dental assistant, vice versa. So I really do like that because I find that my patient will open up to me better. We do connect better. So that's why I chose to do dental hygiene. The next one is communication. This whole, again, any career, you have to have good communication, but especially right now in this field, because you want to be able to communicate with the dentist. What's going on? This is what we have. These are the treatment plans I'm presenting to you. Same thing with the patient. You got to find a way to communicate to them their current state, the importance of their oral hygiene, and just find a way to, try to make it easier for them to understand. The next one is eagerness to learn and continue learning to better yourself. This is really crucial because as a dental hygienist, it doesn't always stop at when you finish school. It never stops. We are always forever a student. Science is always evolving, dentistry is always evolving. So if you're always interested in this field and you're always passionate, you'll find a way to always find a way to learn. All right, so let's talk about the definition. What is dental hygiene? So in the Darby and Walsh Dental Hygiene Theory and Practice textbook, it says, dental hygiene is a science and practice of preventative oral health care, including management of behaviors to prevent oral disease and to promote health. This is where the huge difference between dentistry and dental hygiene kind of make it clear. Dentistry is more for treatment based. Like if a patient has a cavity, they try to do treatment planning to find a way to fix and resolve that issue. In dental hygiene, we're more focused on preventative aspects. I want to try to find a way to not even get there yet. If you do have gum disease, we want to find a way to educate our patients to prevent it from getting worse. Preventative. It's a nice proactive way. Yep. So dental hygiene is educating and again, being more proactive. This is why I'm teaching patients and educating them to brush, to floss, because I don't want them to have bone loss. I don't want them to progress to gingivitis, and then which may lead to periodontitis, which I'll talk a little bit more about. The number one cause of dental issues is unawareness. A lot of patients don't know better. Some people may think, I don't floss, I only brush once a day. That's just what I've been doing. Until they know that this is actually what is recommended, this is what we've kind of shown is best to do. It helps prevent this and this and this. They know better. So they're like, okay, I want to find a way to motivate myself. Um, as dental hygienists, we are considered advocates for our patients' health, oral health. So you're no longer just, doing your job and, end of the day, it's not like that. It's actually, I'm trying to find the best treatment plan, the best course of action for these patients. And when you have someone who's knowledgeable, you go to school, you find all these great facts and these interesting theories about dental hygiene and dentistry altogether, you want to find a way to convert that and make it easier for these patients to understand and break it down for them to be like, these are your different treatment options. And I would like walk them through it essentially. We should never treat a stranger. I like to go by that motto because there's so many different aspects than just, like I mentioned, just scaling and doing like cleaning teeth. It's asking the right questions. I like to know everything about my patients before we do treatment because there could be many different type of contraindications. If patients are taking medication, are they on blood thinners? Are they taking warfarin? If they are taking warfarin, which is a blood thinner, I want to know what is their INR, which is their blood clotting level, time. Because if I'm scaling, like cleaning their teeth, and it's bleeding a lot, it may prolong the bleeding and it may bleed for hours. These are all really crucial things for me to know. Have they had a heart attack in the last year? A lot of people think, well, you're just working on my mouth. Well, I am, but the mouth is the entry to your whole body. Science is starting to prove more and more that oral health links to your overall health. And it's very interesting things. And I think when I'm working in office, I try to educate to patients more because it's not just the teeth cleaning. It's not just going to get whatever just localized in your mouth. It's overall wellness and health. And the last part here is just, again, building a really good rapport, which is a professional relationship between you and your patient. There are many people, like I mentioned, that go to your office and you see the progression of health. Maybe the first time I meet a new patient and they're coming in with many issues, bleeding, swollen gums, inflammation. And then I educate, I teach, and I show them this is a lot of plaque buildup in this area. They come back and they're like, I remember I had a lot of plaque buildup in that area. I focused my brushing and I love that. It's so satisfying. So being a dental hygienist consists of multiple roles. It's not specifically being a clinician or the healthcare or the dental provider in clinic. There's advocate, researcher, administrative, educator, corporate public health. That's a really good one. And a really awesome one is entrepreneur. I'll go for more in depth throughout these slides. All right, the most common one, the clinician. This is when you're working in office and you're working in a private office. Very popular one. This is when I'm using dental hygiene process of care and I'm trying to find a way to prevent or kind of interrupt or control an oral disease, and then overall just promote the health. And we have a way of doing a treatment. So there's assess, diagnose, plan, implement, evaluate, and then document, which I'll also go more into further on the presentation. And as a clinician, you're not just working alone, you're also working with other professionals. I'm working with the dentist. If my patient comes in and they had a heart attack or whatever in the last year, I'll phone up their physician and be like, this is hi, I'm calling for this so-and-so patient. Am I clear? What was their, like that one patient, like I talked about blood thinner, what was their INR level? These are really great things because you're working interprofessionally with other professions. Yes. advocate in public health. So, like I mentioned before, advocating for your patient's health is a huge part of this job. Um, Knowing who to refer to uh, when the patient's, with their issues. If they have periodontal disease, I want to be able to refer them to a periodontist because that will provide them the most necessary treatments and the best care. Um, but advocacy is not only that, but it's also your work in the community. Here in Canada, we have many different programs that allow access for people who may not have the financial ability or has other barriers. So advocating is just a whole other way of finding accessibility for dental care, dental hygiene care to be exact. Either if it's children who are unable to, their parents cannot afford dental care. In Canada, we have a program called Healthy Smiles. It's for children. It basically allows children to get treatment under the age of 18 without having to pay for the high fees of dentistry. Um, and it's like almost like volunteer work. Also, you can be part of the community. It doesn't have to be you have to do cleanings. You can also be part of committees where you are part of the more legislative part of dentistry and finding ways to like fluoride in your water and all that stuff and passing bills and stuff like that. Researcher. This is actually a really interesting one as well, I find. Clinicians is a great job when you're working clinically, but it could play a toll with your body because you're always at this great posture and if it's really hard sometimes. But researching is, again, really essential for dentistry as a whole because, again, science doesn't stop. Science is always evolving. And the only way we can evolve it is with having researchers. And who is better to research about dental hygiene care than dental hygienists? And even if it's for statistic analyzing things or anything like that, large corporations will look for dental hygienists to ask questions, try their products, research about what best products would best fit, most effective in our field. Administrative. I think all aspects of dental hygiene, no matter what field, like what specific role you're in, administrative is pretty important. Documentation as a whole is pretty important. Anything in dent or health is you got to document, you got to chart correctly. But administrative could be all parts as well. When you're doing things like formulating policies and procedures, that's all administrative work. It's a lot of organization. That's another really good skill to have if you're really organized and if you're like really into paperwork and being organized. This part of dental hygiene is definitely for you, for sure. Educator. Again, when you're working clinically, you're educating your patients, you're educating yourself, you're your own teacher at the end of the day because we're constantly learning. But also, you can also be a faculty in the dental hygiene program. I've learned the most from my faculty in clinic at school, for sure. And I'm just reading this. Holding educational meetings and conferences to public or oral health. Yeah. So you don't have to have some crazy degree to get to be a teacher. You can even hold like conferences or meetings with like mommy and me classes. A lot of parents may think that it's okay to, put their kids to bed with a milk, bottled milk, which we now find that it's the risk of causing early childhood caries because there is sugar in milk. There is lactose, which is a form of sugar, and it does cause cavities right on their two front teeth. So a lot of parents may think it's okay, and they think we grew up doing that, but it does have increased risks of cavities in children. Corporate. This is, again, more of the business side of it, but like those larger corporations like Crest, Colgate, again, they're always looking for hygienists to test their product, talk about their product, and see what would best fit in a clinical aspect. They're always trying to find the best advice, and who best fits or gives to give that advice is actual clinicians who work with patients. This is a really great one. Entrepreneur. So, like I mentioned, in the clinical setting, that's the most popular. But there's dental hygienists who are their own boss, and they actually build like their own mobile dental hygiene like van, where you can provide care in the van, or you can provide dental hygiene cleanings at home. Like I mentioned, anxiety is a huge thing. Dental fear is a real big issue. Having this service available is a great opportunity because now we're giving access to these people at home in their comfort of their own home on their own time. A dental office is usually a very overstimulating place. You hear a lot of sounds, there's a lot of people, bright lights. So this service would also be really great for people who suffer from autism or special needs, even accessibility. If you're people who are on a wheelchair or just feel comfortable at home or bedridden, these services are really great to offer to these demographic. And again, you are your own boss. You make your own hours. In clinical, in the private office, I do have a schedule. I have patients on patients. I usually get like what 45 to an hour per patient. But if I was an entrepreneur and I'm running my own program, if I want to educate a little bit more with my patient, I have that luxury of doing so. So yeah, and there's endless amount of job opportunities. Yes. Okay, so I'm just going to talk a little bit about my college. So St. Clair College. This was a 3-year program. The courses consist of very heavy science-based. So I did like dental radiography, histology, embryology, oral pathologies, a lot of ologies. There was a little bit of math too, biostatistics, but I didn't think we didn't need math to go into it. I also took pharmacology. We had to take, I think, 2 years of like a first year, second year, and third year pharmacology. And I find it was very interesting. Medication is huge because it does affect the oral cavity. People who are taking multiple medications have a higher risk of developing xerostomia, which is dry mouth. And if you have xerostomia, which can also increase your risk of getting cavities, because saliva, one of the great jobs of saliva is they lubricate your mouth and it also washes away any of that bacteria. But if you don't have that, then the bacteria and the sugar all stay on your teeth. But that's a whole different point. But the also St. Clair had a beautiful, beautiful clinical setting. That building at the bottom there, that is our health science building. So it was like nursing, dental hygiene clinic was down at the bottom, and each student had their own operatory, which is in that top picture there. So it was really beautiful. At our college, we had to bring our own clients in, which I think was more of the harder part of the program. Admissions requirements. So what I had to do, so I actually had horrible marks in high school. I took a lot of university classes and more harder classes than I needed to, thinking I was going to go to university. Again, I thought I had no idea what I was going to do. So I wanted to keep my options open. But then when that grade 11 year struck and I found out I wanted to be dental hygiene, I only needed my college courses. So I focused on those. I focused on my chemistry, my biology, and my English, and it was great that way. This program is actually more of the overpopulated and more competitive. So we also had to take a HOA test, which is an HOAE exam. This just helps kind of like increase the risk or increase the chances of getting into this program because dental hygiene was definitely competitive. So this is actually my journey. So our program was 3 years. First year was when I went right out of high school. It was difficult to adjust from a very high school mindset where I was just getting by, just show up, do my work, I would pass. And then there's college, which was a huge, huge step. It was hard because I was learning a whole new concept. There wasn't really any dental knowledge or any dental related information in high school, not in science at least. And so that caused me it was a huge amount of information thrown at me that I wasn't really prepared for because my study routine and finding a way to study that worked for me was hard. I didn't have one. So actually on my second semester, my first year, I actually failed one of my practical exams, which led me to have to repeat. And that was the most largest like reality check, because in high school I thought I was just getting by, I was doing what I had to do and not having to worry too much. But then in college, it really made me, when I failed, it really made me think, is this really what I want to do? And if so, I need to buckle down, I need to find a better study technique and do it. And honestly, that really like made me change my mindset and the way I study and the way I handled school, because I didn't want to fail again. But and you know what? Even if you do fail, it's a great opportunity to just have this, to reset kind of your mind, take you that break, and then just get ready for your next semester. And then lastly, how I graduated. I graduated in a pandemic, definitely not the way I wanted to, but I did what I had to do, and it's hard. I 100% give all my love and all my support to any student or anyone who is going through the pandemic and trying to graduate during the pandemic. It really takes a lot out of our experience for sure. So now I'm going to talk about salary and job perspectives. Of course, a lot of us are kind of money's driven. We want to figure out what do we want to do? We want to be able to afford and have an good life here. So it's job opportunities. So I'm from Canada, and I know there are viewers here that are from the US. So I try to put a little bit of both. In Canada, there has been an increase. They estimated to be an increase of 7% growth in dental hygiene. Um, According to our Government of Canada website, they had a statistic analysis job prospects on the website. If you guys are from any provinces, you guys can check that out. But it says in the next 3 years, they estimate that the job prospect is great in at least 7 provinces. And then the rest are either fair or undetermined, but 7 provinces are great. Employment growth will lead to several new positions. A moderate number of positions will become available due to retirement. That's actually very true. Because of the pandemic, actually, you either have a very slow office, or there's actually a very high increase of dental hygienists because a lot of them are just deciding to retire. Same thing with dentistry, I've noticed. And that's in Canada and also in the US. In the US, there's an increase of 6% of employment of dental hygiene is estimated to go 6% from 2019 to 2029, which is 10 years. That's great. And this is actually faster than the average of all occupations in the US. If you think about it, when I drive anywhere in the city, every block has a dental office, and it's usually at least 3 to 4 or 5 dental hygienists per office. So you can already expect that there's going to be great job prospects as well. And the dental hygiene services will increase in demand as the population ages and as research continues that link oral health to overall health. People are going to be like, okay, so dentistry and going to have dental hygiene care services done is important. So there is going to be an increase, and it's going to be busier. So these are some frequently asked questions for a dental hygiene program. I think I'm trying to get into the nitty gritty of what everyone has, or questions that anyone has. So is the dental hygiene program easy to get into? So a lot of these answers are super subjective because of your region or country. But this is majority dental hygiene programs is usually kind of a little bit more competitive, and it is hard. So having that good marks in science-based courses will definitely increase your chances of getting in. In Canada, we also have that HOA test that I mentioned, so that is a great advantage to have. The next question is dental hygiene school hard? Personally, I found it to be a very high demanding course. It was very stressful, but just because it was a whole new knowledge, and I had no knowledge of it going in. But the hardest part was definitely clinical. Having those patients and making sure my patients and my clients came in on time, because it would affect me. And I think that was the hardest part. So if anyone who is interested in dental hygiene program and you're a little bit more worried about that, find a program that offers clients to you. I think that would definitely give you a huge stress relief, basically. Number 3, do dental hygienists have benefits? This is something that I had a question about when I went in. More than 3/4 of dental hygiene do receive employee benefits. Some offices will provide benefits if working full-time or at larger corporations, but mostly privately owned may just give discounts or offer employees free dental care. Um, I don't have benefits. I think it's more of because it is a privately owned office. It's a lot of my girlfriends also don't have benefits as well. Um, so that is just one of the that is one of the cons of dental hygiene because we don't have health benefits or anything like that. Four, what are the hours like for dental hygienist? Well, this is also one of the reasons why I really like dental hygiene. Hours are completely flexible and up to you. You could be a part-time hygienist or you can be a full-time hygienist. It really depends. Um, and you know what? I think that's great for, if anyone who wants to work more or likes the luxury of working a little bit less, there are options out there. You can work at one office, you can work at multiple offices. It's totally up to you. Question 5, who would do well in this program? So I think anyone who is responsible is a self-driven learner, because I'm going to tell you there's been a lot of nights where I have to relearn things or teach myself, which I feel like in the case that's a lot of universities and colleges. But having that passion and that drive to want to learn these things, like I remember like wondering, why am I learning this? Why is this the way it is? Having like that drive and kind of knowing what you want to learn makes it easier for information to retain. And I find that to be a definite benefit. And also being able to work independently or as a team, it's a great skill to have. 6, what is the average salary earned by or in dental hygiene? So again, completely depends on your region and your country. Here in Canada, the average pay per hour is around $35.50. As a new graduate, it may be a little bit less. In my region, I think it's around $27 to like 30, 31. Depends, honestly. But I know in Toronto, which is the more busier city in my area, it's like, I think it's 35 to like 45. Um, so yeah, if you do the calculations, the income salary can range between 53,000 to 75,000 or more, depending on specialties. Like there are general practices where they do a little bit of everything, the traditional dental offices. But if you're working in a periodontal office, they're making good money because they do. It is hard work, but they do make really, really good money. 7, what do I need to do to be able to obtain my license? So first you have to graduate from an accredited dental hygiene program. Mine was a 3-year program. I know that in the States, people have to do, I think, an undergrad and then either 2 years of a dental hygiene program, completely depending. And then completing all your clinical requirements. So completing all your clients, the amount of clients, the difficulties, and then pass clinical practical exams. I also had to complete my board exam, which is a written board exam here in Canada, and I know in the States they also have to too. In the US, I think they have to complete a practical exam with the boards committee. In Canada, we did it with our college. And then lastly, you just have to register with the College of Dental Association of your state or your province. And then lastly, what are some things I can do to prepare myself for dental hygiene school? I think this is a really important thing, and I wish someone told me this before. I think shadowing at a dental office is great. Either if you are in pre-dental or whatever, dentistry or dental hygiene, dental assisting, shadow. Shadow at your dental office, really get a feel of the environment. A lot of people may think, oh, it's good money. It sounds nice. You're in an office, you're sitting. It's not. It's not always like great fun all the time, relaxing. It is quite stressful sometimes. So when you shadow at an office, you see the atmosphere, you see the people. It really does make a difference. It makes it a lot easier for school, I think, especially if you are in dental hygiene school and you have that summer break. Go shadow, because I can tell you how many times I had to reteach myself dental things before I went back to school. Oh, another great thing, another great lesson. If you do have to find your own clients, make friends everywhere, find people, go on Facebook, connect with people in your area, people who may need cleanings. It's better to have multiple people to come in for you rather than not knowing and just kind of going with the flow, it will definitely take a lot of weight off of your shoulders if you have that kind of idea of who's going to be your client. And lastly, having a good group of dental hygiene students that you can kind of fall back on. Um, Finding someone who studies like you is similar to your study regime, and it would be great for group projects. I know third year of dental hygiene school was very heavy with group projects. I think we had no exams in all group projects, but second year was definitely the hardest. So the day to life of a dental hygienist. This is as a clinician in a private practice. All right, so first we do assessment. What I mean by assessments, I mean I'm analyzing my patient. This starts from all the way in the waiting room. I'm analyzing if they need assistance and coming in. Do they have different types of modifications that I need to do before they even get into the room? And then also asking the correct questions. Medical history, dental history, these are very important. Are they taking new medications? For any patients who have high blood pressure, I'll ask them, what was your last reading? If the reading was really high, it makes me a little bit more cautious of, how I'm going to perceive my treatment. Assessment could be anything from checking gum tissue, checking the color. Is it puffy? Is there inflammation? Is there bleeding? I also will take x-rays. X-rays are so important in our field because there's so much bone and there's other things that we are unable to see at a clinical intraoral view. I need to take x-rays. I need to see inside. I need to see what's going on, because bone loss is like the number one thing that really does increase the risk of teeth loss long term. And then the next step is planning and implementation. So once I get that assessment, once I diagnose like, oh, you do have plaque-induced gingivitis, I'm then going to plan what are some goals that I can teach these or tell my patient to work on to get to health. And then once I've kind of established these goals, I'm going to do implementation. Like, oh, this patient had staining at the assessment. How much staining? Should I do a prophy polish? How much buildup do they have? What kind of instruments am I going to use? And then I do it. So then I'll do the cleaning, or I'll do the scaling, I'll do the polish. We do fluoride applications. Fluoride is great for anyone who has high risk of cavities. It helps remineralize enamel, which is the great strong part of our teeth. If a patient is younger and has more of a deep pits and fissures in the molars, that can increase the risk of cavities. So I can actually apply sealants to them. It protects. It's like that one picture in the bottom there. That's a sealant. It kind of makes that it protects the very inner pits and fissures, because if food and bacteria gets trapped in there, it'll increase the risk of developing cavities for sure. And then impressions for appliances. Could be from retainer, whitening trays, periodontal trays, night guards. And then lastly, evaluation and documentation. So let's say my patient had really bad gum disease, and then I did my scaling, I did all the cleaning, I did the education, and then I want to evaluate. Let's see if they actually retained what I taught them. So I'll usually book a patient back in 4 to 6 weeks, or on their next recare. I like to check, how are their gum measurements? How does the tissue look? If the tissue is still red and swollen and there's more plaque builds up there, I'll know what I did was not effective. So then I'll find a different way. So was my brushing technique I showed them not good? Like, could they not use that? So let's switch it up. And then lastly, documentation. Documenting is so important because this is considered a legal document. I document everything that I did. I even document what the patient says, like, oh, I don't really like the electric toothbrush. I don't like this to do this. I don't believe in flossing, da, da, da. I'll document that. And then the next time a next hygienist will have her or have the patient, and they'll be like, oh, so I see that you did this and you didn't really like this. We are one office, and if documenting means that we have a cohesive treatment plan and we all have the same goal, it makes it a lot easier. Okay, so oral health. So this is I'm going to talk about what I talk to my patients about, and what dental hygiene is all about, the importance of oral health, and what oral hygiene instructions and educations I like to discuss with patients in our office. So first I like to, oh, should have give you guys a heads up. There's gonna be some gnarly pictures here. So first I like to discuss with the patients, do you know the difference between plaque and tartar? We hear these terms every day, we hear these in commercials, but do we really know what plaque and tartar is? Tartar is another word for calculus, not math, don't worry. Calculus is just another word for tartar there. So plaque is the soft material that grows on our tooth surface throughout the day. If you ever notice that you've had a long day at school or you had a long day at work, you feel like your teeth are kind of fuzzy and kind of gross, and you can easily like scratch it off. Now that's plaque. It's very easy to remove. You just brush and floss. And that's why we recommend it. Um, if if we do brush, or if there's some patients who do brush twice a day and they floss, there's still some areas that they miss in the back. Plaque will build up, and they'll build up and they'll build up, and then it'll start to calcify. In our saliva, there are minerals like calcium, phosphorus, and potassium, all that stuff. Calcium will make the plaque harden, calcify, which causes the plaque to turn into tartar, calculus. And that is no longer easy for the patient to remove by just flossing and brushing. And that's why we emphasize the importance of annual cleanings and coming in to get a scaling done, because if you see the top picture, that's the plaque. Plaque is very soft and it's very easy to remove, but that bottom there, it looks almost like a stone. That is calculus. And that's actually a very common area for people to have built up right at the back of that bottom teeth there. So let's talk about the different types of gum disease. I know I mentioned a bunch of times gingivitis, periodontitis, and what is it? So what I like to do with my patients is I like to break the word down. Gingivitis. So gingiva means gum. It's a fancy word for gum. It's in dental term. And then itis. Anytime you hear the word itis in medical terms or in medical terminology, it means inflammation. If you ever heard of the word appendicitis or arthritis, it means inflammation of that part of the body. So gingivitis is inflammation of the gums. So it is considered a state of disease. Every time there is inflammation, or every time there is a state of disease, there always needs to be an irritant. And the irritant and the trigger is the plaque and the tartar. So our gums don't like to have the plaque and the tartar on it. And that's why you'll notice some people may have gum recession, which is when the gum goes down. That's because the gum doesn't like to have the plaque and the tartar there. It's trying to move away from it. But the good thing about gingivitis is that it is reversible. If you ever notice redness, swelling, a little bit bleeding when you're brushing and flossing, if you continue to brush and floss, the bleeding and the inflammation will go down and will disappear. So that's a good thing about gingivitis. It is reversible. It'll reverse with good oral hygiene. But now periodontitis is a progression of gingivitis if it's untreated. Now this is when the inflammation and the disease starts leading to the bone. So the periodontitis, let's break the word down again. Periodontium is what's supporting the tooth. So that's like the gums, the bone underneath, and all the periodontal ligaments that connect the tooth, keep it in the socket. And then itis again is the inflammation. So the inflammation of that area. So when your body is constantly under that stress and under that state of disease, it honestly wears your body down. So there's going to be bone loss. There is going to be constant inflammation. And that's why it's very important to stop it at gingivitis. We don't want it to progress to periodontitis, because periodontitis is actually irreversible. Once bone is lost, it's lost unless we do some type of treatment or bone graft or something. So we try to teach our patients these as a preventative way. So these are two different pictures. So one on the left here is a healthy set of teeth. And as you can tell, the gums look amazing. They look very nice, peaked and pointed papillas, which is the gum part of in between the teeth. You can see the color is a nice pale pink, which is great. It means that's a great sign of health. And also there's no gum recession. So this is great. And this is why it's important to look at x-rays. The gum line or the tooth, the bone line there's no bone loss. All the teeth are great. Everything looks great. And everything is nice, tightly together. There's no open spaces. While you look at the picture on the right, there is gum recession. So this patient either had periodontitis, or has it right now. And if you look at the x-ray, there is extensive amount of bone loss. I wish I can show you guys or point to it here, but if you look at that one molar all the way at the back on that x-ray, it's barely holding on. There's not much bone structure exactly right there. On the very lower root of that tooth, there's barely any bone left, and that is the cause of periodontitis. So I wouldn't be surprised if that tooth had mobility. It was moving a little bit. So this is actually the reason why I love dental hygiene and I love cleanings. If you guys are kind of like part of that, you love satisfying before and after pictures. I'm gross like that. I really like to clean these teeth. If you're interested in like, this is also kind of gross too, like pimple poppers and just seeing like gunk come out. I love that stuff too. But I know I'm in the good field when I'm in the right field, when I really like to see patients like this and just look at the before and after pictures. So the first picture, or the top one there, that is a lot of calculus. It's very heavy calculus buildup. And see, now that's very rough. I can already tell right away that patient will have noticed it. And it's quite a big bulk of buildup that has happened. And that bottom picture is after. If you notice how beautiful those teeth look, they're nice and clean, there's no staining. But if you notice the tissue is very red. It's been sitting under that calculus for who knows how long, and it's been congested. Very. So when you see bleeding, it's almost like the body's reaction of trying to breathe again, kind of taking all that bad bacteria out. So gingivitis is a huge part of almost like halitosis. A lot of that bleeding is more of that smell, because it has that dead bacteria and that gross bacteria. And this is another picture. This one has more of staining, and there I can tell right off the bat there is calculus that builds up on that rim of the margins of the gums. And on that next bottom picture, the tissues are a little bit more spaced out. If you see, there's a space in between each tooth. So that part, it is, the tissue has gone away and it won't grow back, but we're trying to keep it at that level. Even if patients come in and they are barely have much to work with, we try to maintain that, because you only get a set of teeth, one set of teeth for the rest of your life. We're going to try to maintain it as much as we can. And this is another before and after picture. This has plaque growing at the bottom there, and you can see the gums looks like it's almost like going to recede a little bit. And once it's been removed, you can tell, look how clean the teeth look as well, like more of a whiter, not so much of a stain. And also, I don't know if you can notice, but the tooth on the after picture is a lot more glossy. Calculus looks more chalky, and that's why if you ever notice or go to your dental hygienist, we blow air, we try to dry the area, because that's how we detect it, more of a dry surface. And look at sorry, Hannah. Yeah, so the tissue, it looks like it has healed tremendously. The inflammation has gone down. The redness is almost a little bit better. It's less of that red fiery color. And there is going to be recession because of how long or that plaquing tartar has been there. But overall, if that patient maintains really good hygiene, they'll stay like that just fine. All right, so this is a little summary of everything that we talked about. So dental hygiene is focused on preventative aspect of dentistry. We try to use and promote and achieve optimal oral health versus doing the treatment base, which is what the dentists do. Dental hygiene care is based on patient care and what their needs and goals are. Every treatment is different. There's no such thing as two patients with the exact same findings and assessments. That's why we try to specify and do everything specifically for that patient. And it's like a individual based care. The dental hygiene program is demanding, but it is a very rewarding career. And I really do recommend either you talk to a hygienist yourselves or ask any questions, because there are pros and cons to any career. But I personally think that this really makes up for it. When you have that patient rapport and that relationship and that professional relationship, you can really see and connect and really learn about your patients. And it really makes you, what I think, it makes me feel like I'm doing good when the patient is happy with their smile. Um, Hours are very flexible and can be adjusted to your lifestyle, so that's always a great opportunity. And I think the pay is going to increase, and I think that's really good. The key to being a successful dental hygienist is finding an office that fits you and being able to adapt and work efficiently along along with a team or independently as well. All right, I just want to thank everyone for tuning in. I want to thank you, Hannah, again for giving me this opportunity. If anyone has any questions, that is my email. And also come follow me along on Instagram and follow my journey as a recent grad as a dental hygienist. All right. So I hope everyone has a great night. And thank you so much.
We have a few questions if that's okay for you to
Yeah, of
answer.
course.
So someone asked, how do you know if an office is the right fit for you? What were some things you looked for when you were trying to find a job?
That's a really great question. Um, I think you can't really ever know. What I recommend to all my girlfriends and all my hygiene friends is make a list. Make a list first of everything that you as yourself must, like you think you must need or you must want. I want a family oriented office, or I must get pay a certain salary. This Having this list is like a nice guide for you to go into an interview and know. You won't know until you put yourself out there, do interviews, read reviews. We are living in the age of great Google reviews and everything like that. Also, talk to your dental hygienist and people in your faculty. These people have been in the field for a very long time, and you know what? The dental fields and the dental community is quite small in certain areas. Everyone will hear of someone, and they'll give you recommendations and stuff like that. And sorry, what was the second part of that question?
It was, what were some things you looked for when you were trying to find a job?
Yes. So personally, I really wanted a full time place. Um, I knew it was going to be hard to find one because most offices are part time, but I kept I kept my options open, and for sure, I wanted a place that was more about patient care. I know dentistry is there is a business aspect to dentistry. It's a growing business, you know, environment, and money is a very important aspect. But I wanted to look for an office that was more focused on patients and finding an office that will grow with me and have time to educate me. I am a new grad, and I think being a new graduate is a pro. It is a benefit to an office because they can mold you into a way and train you to the way that they want as an employee. So, what I was looking for was just someone who is open to teaching me and is more patient based for sure.
Okay. And then someone said your first job at 16 was working at a dental office. What is the best way to approach dental offices to ask for the opportunity to work there?
Honestly, I even to this day, I always say, go in and ask. Go in, show your face, and say, "Hi, I'm interested in going to dentistry. I was wondering if you guys are open to the idea of shadowing." Um, and it's not always shadowing can lead to you working there as a rover. That's what I became, an office rover, which means like you jump around and you help out. If an office is open to teaching you a way to set up a room or clean up a room, it will benefit them, and it would also benefit you because you're learning. You're exposed to that environment for sure. And if you say in that way, I am here to learn, I am open to learn, and I'm sure that they will be happy to have you because it's not just like you're there as a burden. Absolutely not. They'll think of it as we can train this girl. If she's in dental hygiene, maybe she can even work for us, you know?
Yeah. Um, Another question here. What is your best advice for dealing with repetitive patients who do not follow your preventative tips to take care of their teeth?
That is a really great question. I think we have to change it up. Well, then I'll ask them straight up. I'll be like, so what are some reasons why you think that this is not the best way? Or what is it that is preventing you from doing this? If it's money, then we'll find a different way. I actually recently, I've had a lot of patients who don't want to use floss or use a certain thing because it's very wasteful. And I see on Instagram, there's been an account where they are focused on using eco-friendly things, and that is a great opportunity. to educate your patient. Like, if you don't like this, let's use this. So I try to educate them and find a different way. Um, like I mentioned, education, dentistry is always growing. There's always new products, there's always new theories. And I follow a dental hygiene podcast. If you're a dental hygiene student, I totally recommend, because it gives you a whole different view than the typical in school, a traditional method of teaching. Um, and there's always different ways to learn. And sometimes you just got to be creative about it. I think that's what really comes down to. Uh, or even just ask your faculty, even, or ask another hygienist. We are all a community. I think that it would be great to discuss our challenges and our issues with each other. It would definitely brainstorm and give us great ideas.
For sure. Um, Next question is, what has been your biggest inspiration and what's your best piece of advice?
My biggest inspiration, I think, is for sure the patient and realizing, like, wow, look at that buildup I had. And wow, it feels so much smoother back there or on the teeth. That, I love that. Like, that's what I live for. Usually I'll just be like, okay, so go ahead and feel your teeth right now. All right. I'll tell you to feel it after and then tell me how it feels. And then when they're like, oh my God, it feels so much better, I'm like, oh my gosh, yes, that's exactly what I wanted to hear. Um, but my biggest motivation is, I think, just the patients. I just want to do really well for them, and I want them to feel that I am doing the right thing for them. I never want them to feel like I am trying to sell them something or I am talking down on them, because a lot of people come in and they already have that idea that I already had bad teeth, or I have a lot of buildup. Don't judge me. I would never judge my patients. And my goal and my inspiration is to try to break that barrier down and have that open communication. When that patient like comes out and walks and feels so much better after that cleaning, it really makes me so happy to be a dental hygienist at an office like that promote that.
And then another question, a lot of people were asking about the like the buildup on the back of the teeth. What kind of tools you guys use to take that off? Because a lot of times we see like the water pressure and stuff like that, but what
Yeah,
are they? Yeah.
that's a really great question. I should show you guys. I actually have this set from my school when I was in school. So this is our hand instruments. So there's two types. I think that what you were talking about, the water pressure, that is the ultrasonic or the magnostrictive cavitron. So I'll tell you the difference here. So this is hand instruments. Each instrument here is sharp, has almost like a tip here, like this. Each of them are built at a, I'm like a beauty guru with my hand like this. But each of them has its own complex shank. It fits into the crevices quite well, and it fits under the gums, and that's what I scrape with. What the ultrasonic, the air pressure that you're talking about, or the cavitron, it is similar to this, but it does a stroke at a millionth of a second, and it causes air to really flush that pocket out. That's what we use. And that's actually what I would recommend using for those heavy buildups, like our images or like our pictures that we show. Lately, because of COVID and everything like that, we have been trying to stay more away from aerosols at my office. So I've been using a lot of hand instruments. My hands have been getting a good workout. But that's the air pressure, or the water pressure one, is amazing because it removes plaque. It almost flushes the inner pockets out quite well because it kind of like it cleans it out with the bleeding. So these are the instruments that we use for sure. There's a lot of them. There's all these different ones, and they all have different ways of like adapting to the teeth and fitting into the right areas. Yeah.
And then our last question, one we always like to end with, what is your favorite procedure to perform?
Oh, the scaling. Oh, for sure. That big buildup. Oh, I just want to get in there, just pop it off. Like it's so interesting to me and it's so satisfying. I like to clean. I love to clean at home on the weekend. I'm like cleaning everywhere. And so you can tell I really do like that. It's my favorite procedure. Scaling, removing that huge bulk. Love it.
Yeah. Okay, thank you guys so much for watching today. Thank you, Stephanie, for coming and talking about dental hygienists and oral health care. We really appreciate you coming today and talking to us.
Thank you so much, Hannah.